Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Kristin Martin, and she is the owner and CEO of River Valley Medical Wellness. Dr. Martin, thanks for being here again.
Thank you for inviting me, Robin.
So we're talking about maternal mental health and health care. Why is maternal mental health such an important part of overall health care for women and families?
You know, there is a significant importance, and we hear a lot about the maternal health crisis, but not everybody knows exactly what that means. So when we think about 1 in 5 pregnancies in the United States will be affected by mental health or substance use disorders, that's a significant number. But even more importantly, the majority of maternal fetal deaths actually are from either suicide or drug overdoses. And so knowing that, and particularly for the state of Arkansas, where unfortunately we now rank 2nd in the nation in maternal fetal deaths, we've got a real issue that's going on that we have to address this in order to first and foremost do what we do, and that is save lives for both the mom and the child. So knowing that that's such an important part, we've got to remember no matter what our specialty is, right? What your primary care, whether you're mental health, whether you're OB, whether you have, pediatrician, whatever it is that your specialty is, this can very much affect, or you can be a touch point on these women who may be affected.
And what gaps have you seen in prenatal and perinatal services in Arkansas? And you're doing a lot to fill those gaps.
Yeah, so I'd say first of all, I think most people are aware, but if they're not, there's a large portion of the state of Arkansas that has no maternal health that's available. We have hospitals that have closed down their delivery units. We don't have as many OBGYNs that are available. And I'll be honest, in primary care, a lot of times we say, well, we'll refer that to the OBGYN, right? But even within those spectrums, knowing that, first of all, everybody can screen for depression and anxiety, right? That those are important things to be screened for pregnant women or women that want to become pregnant, right? Underlying maybe mental health diagnosis that we can advise people on before they become pregnant. Certainly substance use disorders. And so while a lot of times people will say, when I talk to other doctors, they'll say, no, I don't really have any of those patients in my practice. The fact of the matter is, so often we're not asking the right questions, right? A patient may not be willing to come and share with us, hey, I've got a problem with alcohol, or, on the weekends, I've been doing some methamphetamines, or, I've got this pain issue and I've sought out pain relief, on the streets with opioids. They don't normally come and share that unless they're wanting help. And so it is an important part of what we do in talking and screening people. Because as I say, if we don't ask the right questions, we won't get the answers that can get us to some honest solutions. And there are resources out there. Second part of your question, as far as what are we seeing and what are we doing? So with River Valley Medical Wellness and our nonprofit division that is Arkansas Mobile Opioid Recovery, we actually have an integrated healthcare approach where we do primary care, mental health, and addiction medicine, all in one location. People may need a slice of that pie. They may need the whole pie. Or it may be a family member that's coming to say, I need to know how to best support my family member that is suffering from a disease of mental health or a disease of addiction. So we have those different resources, and we roll them out throughout the state with our mobile health clinics to be able to reach people where they are in their communities. we find that a lot of times somebody may have outstanding primary care, but they may not have access to a mental health provider. They may have to travel statistically over 40 miles to receive any kind of substance use disorder treatment. And so being able to reach our communities is really important face to face, where you can share and, as I say, come up with practical solutions.
You mentioned this integrated model. Is that new? Is that something that you're seeing across the country?
It is more, I won't say that it's totally new. There's been different kinds of models before, but in some ways, yes. There have been clinics before that had what we call like co-located therapists. But typically we saw them like community behavioral health centers, things like that, where they had therapy and they had psychiatry. Being able to reach, and it's really more of a population health concept, being able to reach more people with this specialty care is being studied more and more. And by the year 2030 is expected to be implemented throughout the United States by the CMS. So we're looking at some pilot projects here in Arkansas with the collaborative care model and some other things being funded by SAMHSA. So it is my hope that we not only will know that it works, which we do know that it works, but we'll also be able to encourage our insurance companies, Medicaid, and others to realize that this can actually help reach people while saving costs in care.
And your clinic and mobile units now have point of care ultrasounds. Super exciting. What does that mean for the women you serve, and how does it improve care?
So it is really exciting. And through a grant that we received through the state opioid response grant through DHS and SAMHSA, we were able to buy several point of care ultrasounds, which literally you can see is the size of my hand and palm. So I can stick this in my bag. I can stick it in my purse if I wanted to. But being able to provide ultrasounds to women and to have the training where we could certify not only myself, but my other medical providers on my team, that we can go to rural locations. We can go to crisis pregnancy centers. We can go to residential treatment centers or a multitude of locations. And whenever you have a woman that you say, hey, we have a positive pregnancy test, being able to also immediately offer them the opportunity for ultrasound, especially where these resource deserts in our community, is so important. For women, being able to have that experience where they can see the baby, where they can hear the heartbeat, and we can begin that discussion early on with what kinds of things can we be doing to help your whole person healthcare with this pregnancy really is a game changer. And the neat thing about these ultrasounds is that we hook it up to the iPad, we can do the ultrasound, save the results, and we can immediately send them to any specialist. So we can send it to a high-risk OB at UAMS. We can send it to a radiologist for review. We can save it onto the cloud and allow for that patient to be able to share it with family members. So it's been so exciting, and really, we've had several women that said they'd gone entire pregnancies and never been able to get the appointments or to make it to be able to get those important ultrasounds, which can really help us change their care if there's something significant that's noted that they need an intervention for before delivery.
So cool. It connects Bluetooth?
Yes.
Okay.
Yeah, it can literally Bluetooth to my iPad. And I can sit and show the patient while we're doing the ultrasound on her, and she can see what's going on and be able to save that. And that's just something that most rural women have not always had the opportunity to do and be able to see. And so it's really, really been exciting. It's fun for me as a provider to be able to,
of course,
to engage in that and be excited with that patient and her family.
So how does bringing services directly to the community through your mobile unit change access for mothers who might not, as you mentioned, you touched on this a little bit. Are you seeing that?
We absolutely are. So we've only actually had our maternal health grant a couple of months. And actually I got a phone call right before we walked in for another mother that needs help, right? So I think we've already enrolled, this morning's mother will make 28 that we've enrolled on this, that even though they may have had some pieces of access, maybe didn't have entire access, and they're all women who either have mental health or substance use disorders, that getting engaged earlier, right, means better outcomes for them because it offers them a non-stigmatizing location. We can talk honestly and come up with the solutions that they need for their care. And whenever you are out in a rural area, and sometimes whenever women have maybe associated depression, they feel like, I should be so happy about this pregnancy. Why do I have these feelings of depression and sadness? That we're able to connect with them and say, it's okay. Sometimes this is normal in pregnancy. And I say normal in pregnancy, you are not alone.
Right.
And I think particularly in some of our more resource desert areas, they don't hear that. And so they don't access the help that they need for long-term success.
And you've also added new opportunities for recovery meetings for mothers facing addiction. Why is that support so critical during pregnancy and postpartum?
So first and foremost, just because there's such high-risk times. The physical and emotional changes that occur during pregnancy, and then you add social, economic, and things like that. Even without any mental health and substance use disorders, I think we could all agree that pregnancy can be a very stressful time for everyone. You add some of those other components to people, and again, there's that isolation, there's that feeling of aloneness, and that's where we end up seeing such the high rates of suicide. Oftentimes, women that have had been in recovery or abstinent from any kind of substances for years may actually find that time that is most critical for them in the growth of their baby as the time that they return to use of alcohol, cannabis, opioids, because no one is surrounding them with resources on how we deal with these feelings we're having. For mothers that have been using substances that then find out that they're pregnant, there is a lot of shame and guilt that often occurs, and fear. And so being able to have recovery meetings, which typically people think of those as 12-step meetings, right? We've set up meetings that are all pathways to recovery. So it's not just NA, AA, anything like that. It's anybody can be there. For women who are either pregnant or postpartum, or maybe they're just a mom that's struggling with, hey, I've got these 2 kids and I've got these bills over here and I feel like I'm drowning, and that it is a safe place to go and talk about how they're feeling, get some ideas from other women, be able to get some resources in an anonymous environment. And yet you have a group of women who are all experiencing similar things. And our hope is that they gain knowledge by shared experiences and some experience, strength, and hope.
How do women find out about these programs? Do they have to come to the mobile unit? Is there some resources online?
So we've been sharing this information with our special women's services units that and centers that have to take care of women with substance use disorders. And really, we're just starting to spread out the word. So great question. We should post it on our website for people to be able to come. So that's a great idea. I'm glad you mentioned it. And I think word of mouth, right? Connecting people, whether they are in a treatment center and going home, so that they know that they have somebody to follow up with, that they can connect with, or maybe women in communities that just simply can't access other drug or alcohol treatment. Being able to let them know that. And I think, we look at, the crisis pregnancy centers, churches, their doctor's office. The best referrals may be, hey, I see that you have this issue. I don't have all the solutions, But Dr. Martin's clinic has a free resource for you where you can maybe connect and see. And so those are accessible by Zoom, as a telemedicine, by Zoom access, so that they can participate in those. And we have those a couple days a week.
So great for healthcare providers to know that they're out there for their patients.
Yes, absolutely. Great for healthcare providers to know, nurses, other therapists, people in the communities that may have somebody that they feel like's at risk that wants some help.
So how do you see these expanded services, mental health, prenatal care, and recovery, coming together to improve the outcomes for moms and babies across the state, not just the River Valley?
Right. Part of what the Maternal Health National Survey that came out this last year really said that we've got to build an infrastructure. We've got to connect our resources. We've got to destigmatize these conversations and recognize. And so I think it's, again, it's building these coalitions of like-minded people for people who don't know the information. We continue to go out and educate, right? Hopefully some of these mothers who have success stories can share their personal experiences, because it looks like you or me. It looks like the person next door. It has a lot of faces that maybe people don't realize and recognize. So I think we keep lifting up these women and their families to get the long-term results that we need.
So in close, what is this message, not only with mothers, but the healthcare community that are watching today that may be struggling or looking for resources to help their patients? What do you want them to know?
I want them to know, first and foremost, that there are solutions. There are several different opportunities and resources within the state that we have, that we can help provide and connect with each other. And that not to be afraid to say, I don't know, but be able to know that we're all touch points. We're all touch points in somebody's care. And so even if we don't know all the answers, telling somebody that it's okay, it's okay that you feel this way, thank you for sharing, and let's see what we can do to find you a solution, is, again, letting people know that they are not alone, I think is one of the most important things that we can do for a struggling mother.
Well, Dr. Martin, thank you so much for sharing this important information, and all that you do for the women of Arkansas. Thank you.
Thank you.
And that's it for this episode of AFMC TV. Thanks for watching, and have a great day.